So thank you, sir. And I will start my today's topic, the thought behind using the herb preparations, Ekal Dravyachikitsa, under the Proctology Association today. And thank you, Sangvi sir, and all the team of this for giving me this chance to present my views over here. So, as in Ayurveda stated, dosha dhatu mala mulam hi shariram. So we have to understand first what is the mala. Okay. So whenever so dosha dhatu mala mulam hi shariram. So let's understand the mala first. I always says in my lecture, real beauty is hidden in malaha. So we have to, if we want to become a beautiful, or if we want to make our body beautiful, then we have to make our mala beautiful. I think this will be the different concept to listen, but I'm sure you will be agree with me after 2 minutes, because we are planning the Swachh Bharat Abhiyan. We are trying to clean all our home. We want to, if we want to make our home beautiful, we have to do the proper cleaning of our home. If we want to make our nation beautiful, then also then also we need then also we need to clean our nation. So cleaning and making mala beautiful is the key to become a beautiful. So I think you all of you are now agree with me that real uh, I think now all of you are agree with me that real beauty is hidden in malaha. So let's see here. If according to Ayurveda, this one slide, yeah. If according to Ayurveda, dosha plus dhatu plus mala is equal to sharir, it means dosh, dhatu, and mala are the structural and functional unit of our Ayurvediya Kriya Sharir. In modern science, cell is the structural and functional unit of our body. So, in short, Sharir is equal to body and cell is equal to dosh plus dhatu plus mala. So, if we see here unhealthy cell versus healthy cell, you will find out here in unhealthy cell, uh, only some part of nutrition is absorbed and only some waste products will get out of the cell. That's why that cell will get disturbed and it will lose his proper life. The same way, in healthy cell, a good nutrients can be get absorbed and a waste product will be also good, and it will be evacuated from the cell very nicely. That's why the life of the cell will be good. As it happens at cellular level, the same thing happen at the systemic level also. That's why I'm trying to give you or want to revive this concept once again. Cell is the structural and functional unit of our body, and that's why dosh dhatu mala is the structural and functional unit of Ayurvedic Kriya Shari. That means cell is equal to dosh plus dhatu plus mal. So if we want to make body clean or nirmala, that we say always in Marathi also, we have to make our mind as well as body nirmala. Next slide, please. So, if we want to make our body nirmala, then we have to make it free from ama. So how can am creates the problem in digestive? As all of we know, when there is undigested food in our body, it automatically starts different problems like am and am roga sarvepi mandegne, we all know, and that am basically is the starting point for the um, constipation, we can say. So in modern science also there are different types of constipation: obstructive constipation, or spastic constipation, or we can say when we lost lack of the muscle tone, due to that you will find the constipation. Next slide, please. So like this, if we go through a little bit also leaky gut syndrome or the concept, I'm trying to just correlate you or want to just trigger you on this concept about the how armor gets absorbed into the body with this leaky gut syndrome, and due to that absorption of that arm or any pathogens or anything whatever will be there which will get absorbed into the body, and those all will cause the problem. So we have a skin problems, We have a liver problem, heart problems, a problem from brain to anus, we can say. All problem starts from the gut. It's like a mind gut relationship also, and irritable bowel syndrome like problems also we find from this. So why this is happening? Okay, next slide please. So as we have seen, all these type of digestion, if there is a good digestion, as our Dikshit sir have told us very nicely how it happens, Purish, Snehamsha, Dravamsha, Snigdhamsha, with that only there is a Bristol stool chart also. Okay, if we try to correlate with the modern science also, I'm just trying to little bit collaborate this concept to get more clear. So you will find the type 1, type 2, type 3 like this. Okay, next slide please. Yeah. So in modern science also, for all these type of constipation, you will find the different types of laxatives, bulk forming laxatives or osmotic or a different stimulant. Okay. You know this concept very well. My today's topic is Ek Dravyachikitsa. But before starting the Ek Dravyachikitsa, I want to just click these things because that will make our idea more clear with Ayurvedic perspective also. Next slide, please, sir. So this modern view of treatment for the bulk forming type of laxatives, for lubricating laxatives or stool softeners or saline or stimulant. Next, please. And you know the generic name and brand names also. So we will see the Ayurvedic concept to treat such kind of constipations. Okay. So in Ayurveda, for example, now this is slok from my own Dravya Guna book. Okay, where we have made the classification of the drugs according to the Rasaviri Vipak. So Katu Katu Ushna group is here mentioned for the learning purpose only. Like this, there are 376 medicinal plants in Ek Dravyachikitsa, which we can use very nicely for the Ek Dravyachikitsa of constipation, or we can say like this for any kind of Ek Dravyachikitsa. So just overlook this concept. Chitrakam ardrakam danti maricham krishna jirakaha vidangam shatava hingu raseshu katukatmaka. So when this group come first in our mind, or when we want to learn this group, how to learn the groups? For example, when we are in first year, our Juveka sir always told us when there is a Bhedaniyagan in Ayurveda. Okay, there is a Bhedaniyagan in Ayurveda. Arka, Randa, Chitra, Chitrakachira, Bilva, Shankhi, Nisarla, Hemakshiri, Shishravani, Mukhi Vedani Yoga. When you are going to chant that Bhedaniyagan again and again, without medicine also the patient will get loose motions while chanting the Bhedaniyagan. This is the beauty of Ayurveda. So see the beauty of Ayurveda, learn the beauty of Ayurveda, enjoy the beauty of Ayurveda, and see these minute differences. So if you are in remote place and there is no medicine in your hand or no any drug in your hand, and till if you want to remove the constipation of the person, or you want to give there a mild laxity or virich and karya, so you can make that karya like mani mantra aushadhinam prabhava. You can do that work from the prabhava also. And the chanting of shloka again and again. Arka, Randa, Chitra, Chitra, Kachira, Bilva, Shankhe, Sarla. I think that chanting of the shloka by the Vaidya sitting in front of the patient will make a loose motion to the patient. So jokes apart from this, we will go one by one for the single drug also. Chitrak, Ardrak, Danti, Marich, Krishna Jarak, Vidanga, Shatava, Hingu. This is the 8 classical drugs. So we will see one by one. Next, please. Okay. So now see the Chitrak, which you know, Plumbago xylenica. It comes in Bhedaniyagan. Look at there in Gana section also. Okay. So it is under the Bhedaniyagan. So whenever there is a constipation and with a cruel koshtha, we can say, or a koshtha of kafaj person, where we need the ushnaras, katuvipak and katuras medicine, then there must be chitrak as a first drug of choice in such cases. as like Ekal Dravyachikitsa. And if you want to give the kalpa, yes, then you have Chitrakadi Gutika, Chitraka Gruta, Chitrakavleha, or Chitrakwat, like this you can give. Now, if the patient with the Agnimandya comes in front of you, I will give you the 8 different study case studies like this. So if the patient with Agnimandya is coming to in your clinic for the treatment of constipation, the constipation is due to the Agnimandya now. In case of Chitrak, the constipation is due to his Krura Koshtha or Kapha Jadita Koshtha, Amaj Koshtha, like this. But in Ardrak, there is Agnimandya due to Agnimandya there is constipation. So we know Bhojanagre Sadapatyam Lavana Ardraka Bhakshakam. So you have to just eat the lavan and ardrak before food. So the Dipaniya Karya will be there, and after some days you will find there is a good laxative work also done. So see the beauty. When to use Chitrak, when to use Ardrak, Bhojanagare Sadapatyam Lavana Ardraka Bhakshakam. Then yes, definitely there must be a question in your mind. What about the Danti? So in Grantha, it is stated that Danti Rasad Lapi Chitrakasya Virechani. So if we do the comparative study in between the Chitrak and Danti, so Chitrak is also Kotukatu Vishna, Danti is also Kotukatu Ushna, but as compared to Chitrak, Danti is more Virechak. That's why sometimes Chitrak is told a little bit Grahi, but it is not actually actually Grahi. It is a Bedaniya. It is what we can say. If there is a hard stool, then Chitrak can break that stool with his special peculiar property of Bedaniya, and then the constipation, then it helps to remove the constipation. But vice versa, Danti is Rechak in nature, so you can prefer the Danti whenever you want to do a typical Virechana. That's why it comes under the gun of Virechana. Okay, so you can use the Danti Arishta or Danti Haritki like this. Next slide, please, sir. So I think now you are going to enjoying this type of learning. So in Marich, Krishna Jirak, Vidanga, Shatpushpa, Hingu, we will see one by one. Now, if there is a constipation due to the Krumi and Agnimandya, okay, looking into the third number column. So if there is a Agnimandya plus Krumi, then you have to think for the Maricha. So you can give the Marichadi tel, Marichadi gutika or Maricha Gruta, and it will treat the constipation as well as it will remove the krumi. So whenever you will find the patients with such type of constipations having the krumage history or like tapeworm or anything you can say in type of worms or Agnimandya is also there, then think for the Marich and the Kalpanas made by the Malich. Okay. The next patient, if patient came in front of you having Sukumara, Bala Avastha or Sadhya Prasuta also, okay, then you have to think for the Krishna Jiraka. Krishna Jirak also very nice Katu Katu Ushna medicine and which is very nicely given to such patients. That's why Tel and Arka Kalpana of Krishna Jirak is used for this. So, you know, like Jirakadharist or other medicines also for the Apana Anulomana. So you have to use the property of Apana Anulomana over here. Next drug is Vidanga. So whenever there is more Krumi, Kushtha, and you want a little bit Tikshna, Virechana, you know the Vidangarishta is very nice kalpa. Vidangavlehi is also nice kalpa. So you can use the Vidanga in such kind of Kafaja, Krumija constipation. Are you getting me? If there is a Kafaj, Krumij constipation, you can use the kalpa of Vidanga. The same way, the next medicine is Shatapushpa in Katukatu Ushna only. Okay, Shatapushpa. So Shatapushpa, you know that gripe water for babies we generally gives. Okay, it removes the gases and it gives a mild purgative effect. It's same. The Shatapushpa Churna Tail or Arka is always best for such babies from 0 age group. Okay, so you can use either gripe water or Arka of Shatapushpa. Okay, the next medicine Hingu also. Right now, Dr. Dikshit sir also told that Nabi Puran and other chikitsa. Whenever there is a constipation, always you have to think about the hing also. Constipation with abdominal pain, Udarshul and constipation. Then Hingu does the excellent work. You can keep the Hingu churna in Nabi also, or you can give the Hingvashtak churna, Hingva Divati. Too many preparations are with the Hingu to treat the constipation. Next slide, please. So I think now you are getting how to understand a single shloka. So here Chitrakam Ardrakam Danti Maricham Krishna Jerakaha Vidangam Shatapushpa Hingur Seshu Katukatmaka. So from Katuras, Katuvipaka and Ushna Virya, 8 drugs, how to study accordingly for the constipation only, we have learned with a different angle. Okay, next slide, please, sir. Next one. Yes. So, which are the other drugs? Haritki, Bibitak, Amalki, Triphala, Kutki, Sonamukhi, Isabgol, Erandatel. Okay, you have learned a lot. There is a huge list of Ek Dravyachikitsa in Ayurveda for treating the constipation. But oftenly we are not using this. Okay. So my today's motive is to make our all Vaidyas or all the doctors to think about egg dravya for treating such type of constipation or mala vibandha, we can say. Next slide, please. For example, I have tried to make you group, okay, to treat easily with the what we say with the blessings of our Mahesh Sanghvi sir. He motivated me to teach like this also. So I have made here a small systematic some collection of drugs for you. So for age group from 0 to 18 years or for Garbini, Sukumar or Bal, whenever there see in this all typical Sukumar patient, there is a always Kafanubandha. So use the Ushnavirya Dravya, but having the Katu or Madhur Vipak and mild Rechan property. So first drug of choice is always castor oil or Arundel tel. Arundel tel is very nice and best for such patients. From 0 age group you can use. So just make a lukewarm tail, put it into the nabi of the patient, that small baby, or make a small basti like what we can say a fold of papers and just insert it into the anus of that baby. That mala automatically gets out from the body, and this is the beauty of castor oil. So always try to use the arundel tail or castor oil in such from the 0 age group patients. It's always best. Shatava or body shape or shatapushpa, which we have learned over here, are like the baby gripe water products, so you can use in arka form. Ajmoda is also there. Ajmoda is also one of the excellent drug in 0 to 1 month 2 month babies also. What you have to do, you have to give that ajmoda to mother to chew. So mother will chew the ajmoda, and when she will breathe out the that smelly part of ajmoda to the mouth of the baby, that baby gives purgative action, okay, or it is very nice to reduce the kapha from his body also. So these are the small techniques which we have to use. You can give a woman to the 0 to 6 month baby also. How woman is also urdhva virechana. So Jyotishmati, Yashti Madhu also is one of the excellent drug. I have given woman to 2 days baby only. So you will be shocked. How can you give the woman to the 2 days age baby? So it is not like you have to give the Grutapan and you have to do the woman. Whatever the mucus is coming in his mouth, you have to just mix the Jatamamsi, sorry, Yashtimadu with the honey, make one finger, just insert in the mouth of baby, just clean the mouth, the cuff will automatically comes out and just clean it. So sucking the cuff is also a small woman, that is the Urdhva Virichan. Like this, with using the castor oil, you can do a Laghu Virichan of that baby also. So think the Ek Dravya use of Ekal Dravya use for such kind of baby or 0 to 18 years of age group. Next slide, please. So if we have a more age group from 18 to 35 years, then what is the condition there? As you all know, Bala, Tarun and Vruddha, three types. So Kapha, Pitta and Vata are automatically the dominance of doshas over there. So we have to use the drug accordingly. So in 18 to 35 years, there is always a Pitta Anubandha. So use the Shita Virya Dravya having Katu and Madhur Vipak with Rechak property. So Kutki, Kiratatikta, Aragvad, Yashti Madhu, Kumari, Amalaki must be the drug of choice. So if you don't have the single herb, then think for the Arogyavardhini contains 50% amount of kutki. Bhunimbadi Kwat contains the Kiratatikta. So like this, you can think which kalpana can we can give for the patient. But we have to think for the Rasavirya Vipak, and we have to select the drug for the excellent result, which is my today's take home message. If you want to give the excellent result to your client or patient, then you have to think about his age group for Rasaviri Vipak and the single herb property. Aragvada is over here. Aragvad Kapilavati also one of the best. Yeshti Madhu is here. Yeshti Madhu Ghanavati we give. Kumari also we give. Okay, or Amalki, you can give the Amalki Vati or Trifla also. Next slide, sir, please. So like this, as per the age group also, you can think for the drugs. Age group 35 to 65. Okay, or above, we can say 35 to 65. A little bit Koshtha Sthaulya is over there. So Ushnavirya and Madhur Vipak always works excellent. So Pipali, Patola, Haritaki, Bibitak, Drona Pushpi. Okay, these medicines must be your drug of choice, and this gives the excellent results. Gomutra Haritki or Bhallatak Haritki are also some another culps which you can use over here. Next slide, please, sir. Okay, and if there is a age group more than 65 and above, I know all of you must be facing more problems from this group. So try to avoid the Churna Kalpana in this group. Try to avoid the Churna Kalpana in this group. Give maximum Siddha Taila or Ghruta Kalpana. Why I'm talking like this? Because as we have bifurcated the Kapha, Pitta and Vata age group, this is the typical Vata dominance age group. And for Vata, we know uh, Taila is best. है ना? So if we want to do the Vata Shamana, then Taila or Snigdha Dravya is required there. So too many patients come now, they are taking Kayam Churna, they are taking Trifla Churna, and all aged people generally prefer the Churna Kalpana for making their bowel movements easily. But what happens ultimately after the 1 month, 2 month or 6 month of period using the powder or Churna medicine, the cost becomes more and more ruksha, and it becomes difficult for them to get the laxative effect from the churna kalpana. So for elderly old age people, always use the siddha tail or siddha ghruta kalpana, and that gives excellent results. So you can use the gandharva haritki or castor oil with the milk, or aragvat kapilavati, or sonamukhi with some oil and ghruta preparations. Okay, and you can use the Charakokta different formulations from Kalpasthan. Next slide, please. So actually, if we see how to study this type of dravya, there are 376 dravyas in our dravya gun, out of which 135 dravya are Vishesh Vanaspati and 241 Vanaspatis are Samanya Vanaspati. So whenever we want to use Ushnavirya or Shitvirya from Samanya or Vishesh Vanaspati, then this type of typical tabular format is must be in our mind. Which drug I can use for this particular patient? Okay, and that type of Ekdravya or that type of study will help us to treat the each and every patient, because every patient is different, every patient is unique, and we have to treat each and every constipation case as an individual and different case. So don't try to use a same medicine for all the patients. Okay, next slide, please, sir. So before ending, my last siddhant, which we can share over here, Pratyak Dravya. It is in Marathi. I will read in Marathi and then I will explain in Hindi or English. Swataha Mitra, Natla, Kamgar or Malak, accept from their guna and dosha. If you are ready to try or accept any dravya which it with its guna and dosha, then you will be become able to treat the patients also by getting the knowledge of their prakriti and vikruti, by getting the knowledge of their sharirik and mansik bhav. Okay, some constipations are always from mind, those are not from body. So we have to treat the constipation of mind first, as our Dikshit sir said. With the Jatamansi also the constipation will get cure. So in irritable bowel syndrome, we found such type of cases in number of cases. Okay, so like this, some constipation are from mind, some constipation are from body, some constipation are from which we can say there is a difference in between the avashtamba, malavashtamba, and koshtabaddhata. So avashtamba is the property of Purish. Avashtambaha Purishasi, it is a karya of Purish. Imagine if there is no karya of avastamba of Purish, then what will happen? We have to keep a carry bag with us, or we have to walk with the diaper only, because there will be the no avastamba Purish karya. Due to the avastamba karya of Purish only, we are able to sit and we are able to evacuate our stool after 24 hours, because 24 hours it is avastamba, it is going to store over there. If it is more than 24 hours, then we are talking this is the malavashtamba. Okay, now it is become a male. Imagine if your birthday cake you are eating, that cake, some part will go to the as a nutrient to your body, that will form a prakrut dosha, prakrut dhatu, and prakrut mala also, and some part of that cake will become a mala. So you cannot say like this now, no, 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 this is my birthday cake and I will not eat that. Till it is your birthday cake, you have to make an outlet for him to go outside your body whenever it will become a mala of your body. So understand the dosh dhatu and mala kalpana, and enjoy this what avashtamba, malavashtamba, and last one is koshtabaddhata. So sometimes what happens, in some patients, bowel movements are lethargic or slow, and bowel is not able to force the stool to go outside, and that is a koshtabaddhata. So we have to think when we have to give the medicine to make a prakrut purisha karya of avashtamba, when we have to give the medicine for the malavashtamba, and when we have to use the medicines for the koshtabaddhata. Okay, in this short time of 30 minutes, I have tried to express my maximum views and maximum drugs over here. Whatever the mistakes happen are my, and whatever best I have delivered is of my guru and our